Imagine your brain as a delicate electrical network, constantly balancing signals to keep you thinking, moving, and feeling. For most people, this system works smoothly. But in people with epilepsy, certain sparks can set off a storm, a seizure. Many seizures seem to happen out of the blue. But did you know that everyday factors, from missing a medication dose to a sleepless night, to even strong emotions, can tip the balance and trigger a seizure? There are more than 40 known seizure triggers, and sometimes it's hard or even impossible to pinpoint exactly which one caused the seizure. Often, several triggers combine to make a seizure more likely. On the other hand, some people may think their seizures have a simple explanation, when in fact multiple factors are at play. In this video, we're diving into the most common seizure triggers, why they happen, and how understanding them can help people with epilepsy stay safer and more in control. Missing medication is the most frequently reported seizure trigger. Anti-epileptic drugs work by stabilizing the brain's electrical activity, and their effect depends on maintaining a steady drug level in the bloodstream. When a dose is missed, the drug level begins to drop. If it falls below a critical threshold, the brain loses its protective shield, allowing electrical discharges that the medication was holding back to break through and cause a seizure. You can think of anti-epileptic medication as a dam holding back a river. As long as the dam is intact, the water is under control. But if part of the dam is missing, the water can burst through and cause a flood. Even one missed dose can be risky, and repeated lapses raise the danger even more. For someone with epilepsy, taking medication on schedule is one of the most effective ways to prevent seizures. Emotional stress is the second most commonly reported seizure trigger. What makes it fascinating is that both negative and positive emotions can trigger a seizure. Strong negative feelings, such as fear, anxiety, anger, or grief, may provoke a seizure. But so can powerful positive emotions, like excitement, joy, or anticipation. That's why some people experience seizures during big life moments, like weddings, birthdays, sporting events, or after hearing exciting news. The key point is not whether an emotion is good or bad, but how intense it is. Strong emotions release stress hormones and brain chemicals that make brain cells more excitable. These changes can overstimulate brain regions that are already sensitive in people with epilepsy. Think of the brain like an electric grid. Emotional stress acts like a sudden surge of electricity. A healthy grid can handle the extra load, but in epilepsy, the system is more fragile and that surge can blow a fuse. Sleep deprivation is another common seizure trigger. During sleep, the brain stabilizes its electrical activity, which helps prevent seizures. Sleep deprivation makes brain cells more excitable and synchronized, making seizures more likely. People with epilepsy may experience seizures after an all-nighter or even a few nights of poor sleep. Sleep deprivation is often combined with stress, illness, and substance use, which further raises the risk. It's such a reliable trigger that doctors sometimes use it in EEG testing to provoke epileptiform activity. Fever is a well-known seizure trigger, and its effect depends on whether the affected individual has epilepsy. In someone with epilepsy, fever lowers the seizure threshold in two main ways. First, a higher body temperature makes brain cells more excitable. Second, the underlying illness causing the fever can lead to dehydration or electrolyte imbalance, which can further destabilize the brain. You can think of the brain like a computer processor. When it overheats, it can suddenly crash. In children between 6 months and 5 years old, fever can cause what are called febrile seizures. These occur because the immature brain is particularly sensitive to rapid increases in body temperature. This type of seizure is usually generalized, brief, lasting often less than 5 minutes, and most children outgrow them without developing epilepsy later in life, though a small minority may. Alcohol is another important seizure trigger to keep in mind. While drinking, alcohol actually slows down brain activity and can temporarily raise the seizure threshold. But as the alcohol level in the blood falls, the brain experiences a rebound effect, becoming more excitable and more prone to seizures. This risk is especially high after heavy drinking. For people who drink regularly, suddenly stopping alcohol consumption can also trigger withdrawal seizures, which usually happen within 6 to 48 hours after the last drink. Occasional light drinking may not affect everyone with epilepsy, but binge drinking and withdrawal are major danger zones. That's why strict moderation is advised, and for many, the safest choice is to avoid alcohol altogether. Illicit drugs are among the strongest and most dangerous seizure triggers, and their effects vary depending on the substance. Stimulants such as amphetamines, cocaine, and ecstasy greatly increase brain excitability and lower the seizure threshold. At high enough doses, they can cause seizures even in people with no history of epilepsy, and the risk skyrockets if combined with sleep deprivation, dehydration, or alcohol. Opioids like heroin or fentanyl don't usually cause seizures in small amounts, but withdrawal after long-term use can trigger them. Hallucinogens, including LSD, PCP, ketamine, and psilocybin, can provoke seizures when taken in high doses. While ketamine can sometimes suppress seizures in controlled medical use, recreational abuse at high doses can do the opposite. Cannabis is complex. Some cannabinoids may have protective effects, but THC, especially in high-potency strains or synthetic versions, can actually provoke seizures in susceptible people. Synthetic or so-called designer drugs are the more unpredictable. Their chemical makeup is often unknown and highly stimulatory, making them extremely risky. These substances can trigger seizures even in people with no prior history of epilepsy. Flashing lights are a well-known trigger for some people with epilepsy, particularly those with photosensitive epilepsy, which affects about 3% of all epilepsy cases. Rapid, repetitive visual stimulation can overstimulate the brain's visual centers, causing neurons to fire in sync. This abnormal activity can then spread to other areas of the brain, leading to a generalized seizure. Common triggers include strobe lights at clubs or concerts, fast-paced video games, all CRTs, TVs, or computer screens, as well as certain animations or special visual effects. Hormonal changes during the menstrual cycle can play a significant role in triggering seizures for some women with epilepsy. This pattern is called catamenial epilepsy. In these cases, seizures are not evenly spaced throughout the month, but instead become more frequent around ovulation or during menstruation, when estrogen and progesterone levels shift. Estrogen tends to make brain cells more excitable, whereas progesterone has a calming and protective effect. When the balance tips toward higher estrogen or lower progesterone, the seizure threshold may drop, making seizures more likely. For women affected by this pattern, doctors may adjust the timing or dosage of anti-epileptic medication during these high-risk phases of the cycle. Careful tracking of menstrual cycles and seizure frequency can help identify these patterns. It's also especially important during these times to minimize other common triggers, such as stress, lack of sleep, or alcohol, which could add to the risk. Skipping meals or going too long without eating can be another important seizure trigger. The brain runs on glucose. It's the main fuel that keeps nerve cells firing normally. When blood sugar drops too low, brain cells become stressed and unstable, making it easier for abnormal electrical discharges to occur. Think of the brain like a car engine. It needs a steady supply of fuel to run smoothly. If the fuel tank runs too low, the engine starts to stutter, misfire, or even stall. In the same way, when the brain doesn't get enough glucose, its electrical system can misfire, leading to a seizure. This is especially important for people with epilepsy, but also for children, people with diabetes, or anyone whose body is sensitive to blood sugar swings. Long fasting, strict dieting, or skipping meals can all increase the risk. The best protection is consistency. Eating balanced meals regularly, avoiding long gaps without food, and incorporating slow-release carbohydrates and protein to maintain stable blood sugar levels. Carrying snacks can also help prevent sudden drops, especially during busy days or travel. Seizures may sometimes feel unpredictable, but understanding the factors that can trigger them gives people with epilepsy a powerful tool to stay in control. From missing medication to stress, sleep loss, fever, alcohol, or even hormonal changes, many triggers can be managed or avoided. While it's not always possible to prevent every seizure, being aware of these triggers, taking prescribed medications constantly, and making small lifestyle adjustments can make a real difference. Knowledge is power, and for people with epilepsy, it can help turn uncertainty into safety and confidence. Thanks for watching. If you found this video helpful, consider subscribing for more educational content. Have a great day.